Numerous family members had died of breast cancer, and it seemed to show up each generation between sisters, and I have one sister, so I've always had this feeling of like, is it gonna be me or her? So the radiologist gave me the news that it looked like stage 0 breast cancer. They did genetic testing, and that's when I learned that I have the BRCA1 genetic mutation. It was just like a bomb went off that was just bigger than the cancer. It was this shocking sort of discovery for our family.
Hannah shares how the discovery that she is a carrier of the BRCA1 genetic mutation was like a bomb went off that was bigger than the cancer. Her story is a powerful reminder of how much changes in an instant when patients discover that they have a risk of hereditary breast cancer. Hi, I'm Dr. Tracy Conti. I'm a family physician and a member of the Family Medicine Education Consortium, or FMEC. Welcome to the FMEC's Confidence in Hereditary Cancer discussion series. This series was created with family physicians in mind, although we welcome anyone to join us in learning more about the importance of helping patients identify their hereditary cancer risk, understand its implications, and take action. In previous videos in this series, we addressed a number of topics to help family medicine providers feel more confident and better prepared to address the risks of hereditary cancer with their patients. Along the way, we introduced the concept of narrative medicine and how stories can serve as a powerful tool for communication, education, and empowerment for patient health and well-being. Patients like Hannah, who have a hereditary risk of breast cancer, are filled with questions and concerns. As medical providers, we often focus on and feel most comfortable addressing questions related to health and pathology. But our patients also experience pressing concerns that go beyond their immediate health. For example, about insurance coverage, privacy, discrimination, about how their diagnosis may affect their relationships, and how to tell family members. In this lesson, I'll cover some questions patients may have about insurance, privacy and disclosure, and discrimination. Now, you may be thinking that patient questions about insurance coverage, privacy, and discrimination aren't areas within your purview or ones that you feel knowledgeable to address. However, I'm asking you to keep two things in mind. The first is that these questions may be enormously important to your patients. As medical providers, we understandably see hereditary cancer as a biological phenomenon that requires action and medical intervention. Yet patients view illness within the framework of their entire lives. By listening to patient questions and concerns and engaging empathetically with them, we build a therapeutic alliance with them and ensure more personalized and patient-centered care. A 2017 article on patient-centered communication skills in the journal American Family Physician stated that communication skills needed for patient-centered care include eliciting the patient's agenda with open-ended questions, especially early on, not interrupting the patient, and engaging in focused active listening. Understanding the patient's perspective of the illness and expressing empathy are key features of patient-centered communication. Understanding the patient's perspective entails exploring the patient's feelings, ideas, concerns, and experience regarding the impact of the illness, as well as what the patient expects from the physician. The second thing I want you to keep in mind is that you don't need to be an expert on these topics, but you should know enough to answer some of your patient's basic questions and then be able to point them in the direction of additional resources. And that's what this lesson will help prepare you to do. Let's start with questions about insurance coverage. As their primary care provider, you may be asked by patients if their testing and counseling services will be covered. The cost of genetic testing can vary widely. Without insurance, the cost of BRCA testing can range from roughly $300 to $5,000 or more, depending on co-payments, co-insurance, lab fees, and other factors. So it is important that patients are aware of their coverage level prior to starting any test. Health insurance providers have different policies about which tests are covered and you should always encourage patients to contact their insurance company before testing to ask about their specific coverage. But the good news is that in most cases, health insurance plans will cover the cost of genetic testing and counseling with low or no out-of-pocket costs when it is recommended by a person's doctor. Although insurance plans differ, here are some general tips about insurance cover and genetic testing for both public and private health insurance products. Under Preventive Services in the Patient Protection and Affordable Care Act, ACA, genetic counseling and BRCA testing should be covered with no copayment for women with specific personal and/or family cancer history. Patients should try to use in-network providers to receive coverage at 100%. Services provided by out-of-network providers could result in out-of-pocket costs. BRCA genetic testing for men and for women who are currently being treated for cancer is not covered under ACA Preventive Services, but most private health insurers will cover testing for those who meet specific personal and/or family cancer history criteria. Medicare will cover genetic testing for BRCA1 and BRCA2 when an individual has a personal history of breast cancer and meets one or more of specific criteria, such as a diagnosis before the age of 45 with or without a family history, 2 breast primaries when the first cancer diagnosis came before age 50, a close male blood relative with a history of breast cancer, an ethnicity with a higher mutation frequency, or a close blood relative with a BRCA1 or BRCA2 gene mutation. For patients with Medicaid, some but not all genetic tests will be covered. Medicaid plans vary depending on the state from which the patient receives insurance benefits, what testing is being ordered, as well as their personal and family history. Some Medicaid plans require a pre-authorization for testing. For patients on Medicaid, it's important to check with their specific plan about coverage. Most private insurance companies cover the cost of genetic testing. Some insurers have specific criteria in place to determine who is covered for certain types of genetic testing and may or may not require pre-authorization for testing. The tests themselves are billed directly from the laboratory that runs the tests. Many labs will contact patients directly if their out-of-pocket expenses will exceed a certain dollar amount prior to starting the test so they can make decisions about whether or not to proceed. Patients in self-insured plans should talk to their employers. Self-insured plans are typically run by large companies where the employer itself collects premiums from enrollees and takes on the responsibility of paying medical claims. These plans are not required to abide by all of the Affordable Care Act rules, so asking about coverage is important. One final note about insurance is that direct-to-consumer genetic testing, which ranges from under $100 to thousands of dollars, is not considered diagnostic and generally not covered by health insurance. We talked a little more about direct-to-consumer genetic testing and why we advised against it in the video Setting Up the Family Practice for Hereditary Breast Cancer Risk Assessment, Testing, and Counseling, Part B. Another topic patients may want to talk to you about relates to privacy protection and potential discrimination. Patients may ask you about confidentiality, how information in their medical records is used, and how it might be used against them. Genetic discrimination occurs when people are treated differently by their employer or insurance company because they have a gene mutation that can cause or increase their risk of an inherited disorder. Concerns about privacy and fear of discrimination are common concerns among people considering genetic testing. People considering genetic testing may want to know more about their state's privacy protection laws before they ask their insurance company to cover the cost. When patients don't understand the current protections that are in place, they may be afraid to use their insurance to pay for testing and instead opt to pay out of pocket for the test or pursue inadequate direct-to-consumer genetic testing. The good news is that several laws at the federal and state levels help protect people. Let's talk about one federal law called GINA, or the Genetic Information Non-Discrimination Act of 2008, that's designed to protect people from discrimination. GINA's two parts, Title I and Title II, address discrimination in both health insurance and employment. GINA prohibits health insurers from using genetic information to make decisions about an individual's eligibility for health insurance premiums, contribution amounts, or coverage terms. This means that health insurers cannot use a genetic test result or family history as a reason to deny health insurance or decide how much to charge for health insurance. GINA also makes it illegal for insurers to consider family history or genetic test results as a pre-existing condition. GINA also prohibits employers from using your genetic information to make employment decisions. GINA and other laws do not protect people from genetic discrimination in every circumstance, however. For example, GINA does not apply when an employer has fewer than 15 employees. GINA also does not protect against genetic discrimination and other types of insurance that are not health insurance, such as life, disability, or other long-term care insurance. As a family physician, we can help our patients connect to resources outside of our practice to find answers to these and other questions. For instance, the organization FORCE, which stands for Facing Hereditary Cancer Empowered, is a fantastic resource to direct patients to. The FORCE website at facingourrisk.org includes information on federal laws and protection for those affected by hereditary cancer, public policy initiatives at the state and federal level, insurance and reimbursement, including tips for insurance appeals, links to a variety of options for financial assistance to offset the cost of genetic services, and a variety of other privacy and legal issues. On the FORCE website, patients can sign up to receive newsletters, attend support meetings, and even be matched with a peer navigator. Throughout this series, we have been emphasizing how family physicians are at the heart of the early detection and prevention of hereditary cancer. You and your care teams are uniquely positioned to assess your patients' risks and counsel them on options to help them evaluate and reduce those risks. You are also uniquely positioned to listen to and respond to patient questions about concerns about insurance, privacy, discrimination, and confidentiality, as well as point them in the direction of helpful resources outside of your practice. As Hannah so vividly described in the video clip at the beginning of this lesson, being diagnosed as a carrier of genetic mutation is like having a bomb go off in your life. Everything is upended. Everything feels out of control. The more we can deeply listen to and empathetically respond to our patients, the better the care will be that we provide for them. This is where narrative medicine can play an important role. Narrative medicine is a tool that allows us to see, hear, and feel different perspectives that helps us better connect with patients and ultimately can make us better doctors. Be sure to check out lessons 1 and 2 in this series for a more in-depth discussion of narrative medicine. Be sure to also visit the CDC's Bring Your Brave website, where you will find a rich collection of resources and stories about confronting hereditary cancer from the perspectives of patients and providers. Hannah's full story is among them. Let me recap the recommendations we have made in this lesson that can help you and your patients navigate thorny questions about insurance, privacy, discrimination, and confidentiality. Become familiar with your healthcare system's resources for providers and patients in terms of legal assistance, ethic committees, policies for referral for genetic testing and counseling, and more. The legal and reimbursement landscapes related to genetic testing are constantly changing. Develop a process within your practice or healthcare system to ensure you are updated and supported with current information. Make sure you and your healthcare team are prepared with basic answers to common questions about insurance coverage, privacy, and discrimination. And lastly, to access stories that can serve as resources for both your patients and yourself, be sure to visit the CDC's Bring Your Brave website. Thank you for joining the Family Medicine Education Consortium to learn about supporting patients' common questions and concerns about insurance, privacy, and disclosure. And be sure to check out our additional videos that are a part of this Confidence in Hereditary Cancer discussion series.